Tonight, the incoming head of the Canadian Medical Association, Dr. Anne Doig, says the government-run healthcare system up there is, quote, imploding, unquote. As you may know, some liberals point to the Canadian healthcare system as what we should have here in America. But do we really want a health system that's imploding? Dr. Doig declined to appear this evening, but joining us now from Vancouver, Dr. Brian Day, an orthopedic surgeon and former president of the Canadian Medical Association. Dr. Day, what is the biggest problem with your healthcare system in Canada?
Well, the biggest problem is access, and by access I mean we have in the Canadian system, the first line of defense for a sick patient is a family doctor, and out of a population of 33 million, 5 million Canadians do not have a family doctor.
All right, so you don't have enough doctors. And is it because the doctors don't get paid as well as they get paid in the United States? Per 100,000, you're down about 30% from where we are. We have 30% more doctors per 100,000. Is it because you don't pay them as well?
No. We rank 26 out of 28 in the developed countries in the number of doctors per population. It's it's part of the mechanism of rationing that has to happen when you promise to deliver everything and don't have enough resources.
Okay, so you have enough doctors, but you have too many cases and too much illness to treat, and so people get on a line and they have to wait. Is that a major problem, rationing in Canada? Are people suffering because they can't get in to see a doctor?
Oh yes, we have over 1 million people waiting for surgery, and probably another 1 million waiting to see the specialist before they get to wait for the surgery, and that's out of a population of 34 million.
I know,
people.
we have 300.
So
we have 300 plus million. Well, that's very disturbing because our government tells us that would not happen here. That everybody would be look. If I need to see a doctor, I can see a doctor within an hour. Because I buy my own health insurance,
yes.
and I go in and I make an appointment, and a doctor sees me, and that's that. But projecting out, doctor, you're in Vancouver. If we do pass the Obamacare bill and the government then has a big say in how much doctors are paid, what procedures they can charge, do you foresee rationing of care here?
Well, I'm not complete. I've listened to President Obama, and you know, my take on this is that we are focused on each other. Canada's health, the doctors of Canada have overwhelmingly endorsed a transformation of our health system. It needs to change, and it's not working. We wouldn't want to we wouldn't want to copy your system as it is now, and we don't believe you probably would want to copy ours.
Well, I mean, there are a lot of people in America that point to Canada as being, hey, let's do what they do up there. And as you know, Americans in New England and other states cross the border to buy cheaper drugs, prescription drugs in Canada and all of that. Now, okay, so access to care, rationing is a huge problem. What else? What are the other problems you have up there?
Well, cost. I mean, right now, of government budgets in, say, British Columbia, where I'm from, 42% of the total spending is on healthcare, and it's projected to rise to 80 to 90% in the next several years.
Why so much?
Because it's very expensive when it's a very expensive item in our budget, and we promise everything. In fact, the other misapprehension about the Canadian health system is that we have a single payer system. We have 70% of Canadians have to carry private insurance so that they can get their drugs covered, which aren't part of the government system, or get if you have a heart attack and need to get to the hospital, that's considered not medically necessary under our health system. We have 30% of individuals in Canada who don't have that type of insurance, and so there is a myth. We have many other groups that are not part of the single-payer system, like injured workers, the Canadian Armed Forces, the Federal Police Force, and so on. So there's a lot of misinformation out there about our system.
President Obama says if we pass this big $1 trillion bill over 10 years, that health care costs will go down in the United States. You're saying that in Canada they have skyrocketed. So I'm just saying this is what we're hearing, we don't know. Does it seem plausible to you that if Obamacare gets passed, our costs are going to come down?
I don't think so, because Canada's system, for instance, was just rated on a value for money basis by a European group that rates all of the European countries. And out of 29, alongside 29 European countries that were rated, Canada came in bottom in value for money.
Well, all right, Doctor, we appreciate your candor. Thanks very much. Directly ahead. Jon Stewart.